Hi everyone, welcome back. I just wanted to give you guys a little update on everything that's been going on between the whole surgery versus family medicine kind of thing. Um, so as before, I was really into surgery. If you haven't watched that video, I'll link it down below, and it gives you all the reason why I love it and all that stuff. Today, I just finished, well, not today, basically a week ago, I finished my family medicine PCE, which is primary care elective in solely family medicine. What's different about this guy is that he worked with a group of physicians in a clinic, and he also was on call at the hospital. So he would do rounds at the hospital and then come and do clinic hours, and he would also admit patients who he saw in clinic that were sick and stuff. The other guy that I had my core rotation with in family medicine, he had his own small little practice. It was just him and his nurse and coding assistant. And so it was a really different feel, like a really different vibe. The family med doc that I was with before always told me I sucked, and he actually sat me down this one day, was just like, I'm not the one to give compliments, and I hold myself to a really high standard, so I hold you to a high standard, so don't expect me to compliment you. And I was like, okay dude, I totally understand, you don't have to compliment me. That's not what I'm here for. I'm just here to learn. And this family medicine clinic, like every day, everyone was just telling me, you're doing such a great job, keep up the good work. And you say you don't care, but it feels good, you know? So that's the whole vibe between the two clinics. And at first, in the beginning, I was just like, yeah, I don't know if family medicine is for me. I always thought of it as like, I love continuity of care. Like, I want to follow my patients from when they're born to their adolescent years of when they do stupid shit, and I want to counsel them through their teenage years about sex and contraception and making good choices, and then maybe I can even be there for when they have their own kids and things like that. Like, I always dreamed about following my patients for longer stretches of time. But I guess, like, I always imagined that the continuity of care is what is going to connect me with my patients, and it is what gives me that fulfillment with medicine. With surgery, I liked it so much because I felt like I was responsible for that patient. When the patient came into the clinic, I would see them, and then the surgeon would see them. And that's the first time, it could be the first time that the surgeon sees them at all. So my HPI, or my history, and what I got to know from the patient is what they know. I'm in the patient's surgery. I follow them closely after. I monitor their electrolytes. I take care of their pain. I make sure they're walking. I make sure they're discharged on time. Like, I'm responsible for those patients. And that's what I didn't experience from any other rotation that I've had so far. I haven't had internal medicine yet, but surgery, like, I was in the hospital and I was there and I was just like, oh, I want to see like what's happening to all my patients. And so I felt like just that aspect of it made me want to become a surgeon because of the feeling that I got. And I never got that feeling in family medicine because I feel that the patients that you get there already have such a strong relationship with the physician, and there's no way that you can build that same relationship in the 5 minutes that you get to spend with them. And the one thing that my family medicine doc said to me that resonated is that you're just gonna have to make that leap of faith and trust that what you choose to do will pan out, because when you choose to do family medicine, you don't really know what it's like to have that continuity. You don't know what it's like to have that relationship that doctor has, and you'll just have to make that leap of faith that one day you will have that relationship, and that relationship will bring you fulfillment, and that's exactly what you're looking for. All being said, there's so many other things about family medicine that I didn't realize that is possible, you know. So the doctors that I spent time with, they were still able to go to the hospital and round on all their patients, and that's what I still want to do. Like, I still love working in the hospital and I love the environment there, but at the same time, like, I love the clinic and I love OMT and being able to use OMT in the clinic. They also do a lot of procedures outpatient. I love suturing. That's probably my favorite part of surgery, like putting things together and making it look nice. And they still do a lot of that. And a lot of them go overseas every year to do a mission. One of the doctors, there's 4 doctors in the clinic, and one of them right now is in Honduras. He actually decided to go there for a year and just work there. And he has a blog. He's actually a really good writer. I'll link his blog down below, but he talks about his experience there. He brought his wife and kids, and they're going to school there and integrating into the basically the place there, the clinic, I don't know. But he brought his family there, and he writes about like taking bot flies out of people's heads, having conjoined twins that he had to separate, delivering babies, and I feel that if I needed to do surgery, or if I wanted to do surgery, if I had that itch or whatever, I would still be able to do things like that. And the one thing that really is pushing me into family medicine right now is that I want to start a family. I want to have kids, and you know, I love to travel. I love to eat. I love to explore, and I don't know any surgeon who started a family in residency, who decided to get married in residency. They always held it off until afterwards. And me personally, if you can do it, that's great. But I don't want to wait 5 years to start a family. So I love medicine, and I feel that medicine is the only thing that I can imagine myself doing for the rest of my life. That being said, I don't want medicine to be the only thing that defines me. I want to be a wife. I want to be a mother. I want to travel the world, see new things, learn different cultures. And as a surgeon, I feel that every surgeon I meet, it's just all about surgery. Yeah, and I understand, because surgery is fucking awesome. You know, being in the OR, the thrill, the excitement, the adrenaline rushing through you, it's an amazing feeling. But I don't know if that feeling or just surgery can replace everything else that I want in life. And that's why right now I'm leaning more towards family medicine. One other issue I forgot to mention is that a lot of people are telling me, yeah, you should just become a surgeon because they make more money. You won't be worried about bills and, you know, worried about paying loans back in general. As a family medicine doctor, you probably work just as hard and you get paid a lot less. My thoughts on the issue is that I can make money doing anything. My fiance works and he does fairly well, and I'm not concerned about that at the moment. But saying in the future I should choose surgery over family medicine because of the money is totally wrong, because I can make just as much money doing family medicine. And some of you guys are probably like, what? This girl's crazy. Can't make as much money doing family medicine. But it's true, because I do OMT. I'm really good at OMT, and I can charge for OMT. And so every time a patient comes in and I do any sort of OMT, it's charged as a procedure. And I don't know exactly how much that is yet. And I have my OMT rotation this May. So I'll keep you guys, that's definitely one thing I want to talk about. Like, how much does a family medicine doc actually make, and how much would they make if they do use OMT? I've heard it's anywhere from 2 times to 3 times as much if you do use it in your practice. Yeah, a lot of the family medicine docs I know live pretty happy lives, or the happiest people I know. And so if money is the one thing that is pushing you into a certain field, then I have to say personally that there are other ways to make money. It's so crazy, because literally 2 weeks ago, I was just like, surgery all the way. I wasn't even looking into family medicine residencies. And then something in me just, I don't know, just clicked, and I'm just like, can I do this, or do I really want to do this? Now our school curriculum is that you have to do at least 10 units of surgery and 10 units of internal medicine and 16 units of electives. And so since I have to do 10 anyways, I might as well do some audition rotations in surgery. And I'm young, I can travel to the East Coast if I wanted to and live 4 weeks at a time at random places. Like, that would be cool to do. I don't mind doing that. And if I end up realizing that, hey, I love surgery, and hey, I can give up everything else to do surgery, that's fine. But right now I'm gonna do both. I'm gonna try to apply for family medicine audition rotations and surgery audition rotations and see where that takes me. There's a very small time frame where you can do everything because the interviews only go up until November. So you want to do all the ones that you want and get your face in within that time frame, anywhere from like August to November. So we'll see how everything goes, and I'll keep you guys updated. But as for right now, I think family medicine is in the lead. Thank you all for watching. If you guys have any suggestions or your experience about how you picked your specialty or what to go into for residency, please let me know. It'd be awesome to hear other people's advice. And yeah, please don't forget to subscribe for more videos. Bye. Felt tired, but the days never felt long. I would work